Good morning, everybody, and welcome to Policy and Practice's final webinar of 2020. This month, we're going to be looking at a policy review of the year and also looking forward to 2021. And it's great to have so many people on the webinar this morning. Thank you very much for joining us. Just to kick us off and get started, I'd like to do an audio check, please. On the panel on your right-hand side, please raise your digital hand just so that I know that you can hear me. And in the same panel there, you'll see the functionality to ask questions of our speakers today. So please do that throughout the webinar. You will see also that there is a download there, our product brochure. So do take a moment to download that as well. Nice and interactive this morning, a couple of polls for you and a survey at the end as well. We have a lot to get through. It's been a very busy year in terms of policy, so we aim to finish by around about 11:40, but with plenty of time for question and answers because it's been such a busy year and we had the policy experts on for you today. There's going to be an optional 15-minute demo at the end by Deven. So do stick around for that if you can. The slides and the recording will follow automatically, so no need to take too many notes. And also, if you're on Twitter, do give us a follow and we'll follow you back. We are at policy_practice and we shall see you there. Thank you very much, everybody. Brilliant. So for those of you who might be new to Policy and Practice, just a tiny bit about us. We exist to give the best support, to help you to give the best support you can to help people on their way. And we do that in a number of different ways. As I said, we're a team of professionals with extensive knowledge of the welfare system, and we are all, in our own different ways, we're very passionate about making social policy work. We help over 100 local authorities to use household level data to identify vulnerable households, target support and track change over time. And our award-winning benefit calculator engages over 10,000 people every day, and we identify the steps that people can take to boost their income from the welfare system and other sources, lower costs and build financial resilience. And today, as I said, though, we're going to be very much focusing on the policy year that we have had. So without further ado, let me introduce you to today's panel of speakers. And I'm delighted if everybody could unmute and put cameras on, and then we can all say hello. Thank you very much. So my colleague, Zoe Charlesworth, Director of Policy and Operations at Policy and Practice. Zoe, do you want to say hello?
Yeah, thanks, Janet. Good morning, everyone.
And my colleague, Paul Howarth, Policy Consultant at Policy and Practice. Paul?
Hi, everybody.
Morning. And my colleagues Duncan Hatfield and Deven Ghelani, both of whom are in our London office, a little bit cold because the windows are open and they're trying to socially distance. But Deven and Duncan, do you want to say hello?
Morning, great to see you.
Morning, everyone.
Lovely. Thank you very much, everybody. Excellent, and more of our speakers shortly. So the agenda that we're going to be going through today, as I say, quite a lot to get through. So we are going to give a brief recap of the demand that has been placed on the welfare system this year, and also the policy changes that have been introduced throughout the year. And in particular, we've picked out a handful of different areas where we have done some research and analysis on the policy elements. So Paul is going to take us through our work, our 18-month project for universal credit in Wales. And forgive me if I've got this wrong way around, but I think Zoe is going to talk about the local housing allowance and homelessness and the introduction of the COVID-19 measures. Duncan is going to talk to us about sick pay and test and trace and the free school meals. And sorry, Zoe's also going to talk about the LHA rate and the benefit cap. And then Deven is going to talk about what the future may hold and looking forward, and some seeds for optimism, we hope. So without further ado, I'd like to hand over now to Zoe.
Hi, thanks ever so much, Janet. Yeah, it's been some year, hasn't it? I'm sure everybody who's on this call has had the same sort of befuddled feeling throughout the year as we've had at Policy and Practice. Things have been changing rapidly. So if we just have, obviously most of this is in relation to the economic fallout from COVID-19. I'm going to do a very brief recap because we've got so much research we've done this year that we'd like to share with you that I don't want to spend too much on this because it's all been covered in other webinars throughout the year. But just to remember what a year it's been. From March to September, there's been a 90% increase in people moving to universal credit. It's now 5.7 million people on universal credit. I think this did underlie, this rapid increase in universal credit really did underlie how responsive it could be to that number of people coming onto benefits. But it also, it also underlined the gaps in provision and the issues around universal credit. So it was a lot of learning for, you know, with this many people going onto support. Unemployment's been rising. There's 1.6 million unemployed currently. That's been 117% increase. The second quarter of next year, it's expected to rise to about 2.6 million. So we're still expecting that to rise. At the moment, claims for universal credit are steady after a big rise. So we're almost back to pre-pandemic ongoing levels. And that's because of a lot of the measures that have been put into place, which we'll come on to. We've got 7.5 million people currently furloughed. The OBR presumes about just under 10% of these will actually lose their jobs. So that goes into that additional million unemployed we're expecting to see in the second quarter of next year. And there's been 800,000 job losses. So yeah, it's been a real year of change. All this has obviously caused increase in debt, hardship for households. 6 million adults have fallen behind on at least one bill, and 2.8 million households have missed a council tax payment. Now, this is partially because in the UK, only 41% of households actually had enough savings to see them through 1 month without earned income coming in, which means there's been a lot of households falling into crisis due to the economic fallout of COVID. The government obviously responded to this. There's a coronavirus job retention scheme and the self-employed income support scheme. These were the two main measures to support incomes. These were obviously there were major economic reasons for doing this to ensure that businesses could respond rapidly when the economy opened up again. But I also think this is almost a recognition that benefit levels were never a level that people could live on. If we look at all these support measures that go alongside this, the stay on evictions, mortgage holidays, it was almost an acceptance that universal credit and the welfare safety net as such wasn't enough to support vast numbers of the population. We also saw increases in benefits. The LHA was increased to the 30th percentile of market rents, and we'll come on to that on a piece of research that we did a bit later. Minimum income floor for self-employed was suspended, and there was a £20 uplift for people on working tax credits and universal credit. Alongside that, there are all sorts of other grants for businesses administered by local authorities. And just recently in the spending review, we had additional support to local authorities that they could use for people to support non-collection of council tax, and also to support additional numbers of people coming onto a council tax reduction. And there was also another measure that's been introduced very recently, was a response to the Marcus Rashford campaign around free school meals, to give local authorities money to administer to people who are struggling to pay bills, and also to cover meals for school children over Christmas and probably up to the next half term. Thanks, Janet. Even with all these provisions throughout the year, and I know there's a lot of frontline organisations on this call who will have seen this, many people have fallen through the guts. There's a real, I think the messages we've had at Policy and Practice, there's a real feeling of unfairness for those who didn't qualify for the self-employed income support scheme and the coronavirus job retention scheme, because the differences in support there to universal credit are vast. There's also been those who haven't even been eligible for universal credit. So particularly those who were due to their partner's income or savings over 16,000, I think this has come as a real surprise to many households. But there are also those who under the regulations just aren't eligible for universal credit. And that'll be people without recourse to public funds, and also students who are working in order to cover their living costs, who couldn't rely on their parents, and they can't claim universal credit. And the COVID uplift, the response by the government of the benefit increases, just didn't reach everybody. There were people on legacy benefits didn't get the support, and also the benefit cap wasn't increased in line with those changes. So a lot of people who were capped didn't see those changes. There's been a huge increase in discretionary support around the edges of the welfare benefit system. So I always like to think of this as actually the safety net is actually the discretionary support rather than the universal credit. And we're seeing more and more of this. The government is responding by grants. So we've got DHPs, the Winter Support Fund, and we've got to remember the enormous increase in food banks usage, which gave out 2 million food parcels this year, and they are expecting that to increase to 4 million next year. Thanks, Janet. And the other remarkable thing, so frontline organisations we work with have just been incredible. The response has had to be quick, because we ended up with the government support schemes. They were ended, and there were the part-time coronavirus job retention schemes. Then they were brought back in. All these frontline organisations have been responding to this change of policy really rapidly. And we've been working with so many organisations that are using really stretching the resources they have to support as many people as possible. Deven will be talking about that a bit later on. At Policy and Practice, we haven't just been working with our with frontline organisations. We've also been undertaking an awful lot of research this year, and obviously there's been a lot of policy changes, and that means we're very interested in actually using the data that local authorities have to actually see the implications for households. So this is a quick slide here showing some of the reports we produced. We also have provided evidence to four select committees and given actual all evidence at 3 of them. So it's been a very, very busy policy year for us. Thanks, Janet. Just want to come on to, these are the sort of research, the specific pieces of research that I've picked out for us to discuss today. And this is because I think nearly all of these still have ongoing implications. So they're not in the past, that the findings from these research do actually feed into the situation we're in now and what we're expecting next year. Thanks, Janet.
Great, Zoe, thank you very much. And now I'm going to hand over to Paul to take us through the first of those pieces. Thanks, Paul.
Janet, welcome everybody. I just want to say a few words about a major research project that we undertook just before the pandemic struck for the Welsh Government. The aim was to get a better understanding of the impact of universal credit in Wales, in particular the impact on the Welsh CTR scheme, Council Tax Reduction Scheme, and on council tax arrears and rent arrears. Study was wide-ranging and quite groundbreaking, really, in that it involved analysis of administrative data from all the 22 authorities in Wales, as well as major surveys of claimants and stakeholders. And I picked out these 4 key lessons. First of all, that a generous council tax reduction scheme pays off, that universal credit has or is beginning to result in council tax and rent arrears, that awareness of council tax reduction and certainly take-up is still far too low, and that the impact of universal credit on CTR can be mitigated. So let's go to the first of those. Generous council tax reduction scheme pays off. Now the Welsh Government scheme had different arrangements in Wales than in England, but the Welsh Government scheme covers all 22 authorities in Wales, and it's pretty much uniform. A few twiddles around the edges, but pretty much uniform. And the Welsh Government funded the 10% budget cut back in 2012, which means that all council tax reduction awards are based on 100% liability of council tax, contrary to the position in England. And what we found is that council tax collection rates and council tax arrears as a percentage of council tax due have remained broadly constant in Wales. And this mirrors evidence of other studies that the generosity of council tax reduction schemes has a direct bearing on collection rates and arrears. If we move on to the next one, what we're finding here is that, despite what I've just said about arrears, there is some emerging evidence now of increased council tax arrears under universal credit. Our study showed that council tax arrears were more common and more severe under universal credit than under legacy benefits. And these trends appeared to be pretty much consistent across different demographics and different groups of customers. And the reasons given for this were that in universal credit, often the benefit amounts awarded were lower than under legacy. There was the 5-week wait and the move to monthly budgeting. All of these things had an impact on the way that families dealt with their finances. So in short, there's evidence here of an emerging problem. If we move on to the next point, this is about take-up. And it is worrying, really, that the Welsh Government has estimated that take-up of council tax reduction is still around 60%, or between 55 and 65%. And that's very much in line with traditional estimates going back to council tax benefit days. And so really take-up is still a particular issue. Now, Welsh Government are well aware of this. They're mounting an active campaign. But all the evidence we found, and that this is borne out with other studies, is that direct targeted interventions have the better outcomes. Now, awareness is a real issue as well. In our surveys, we found some very interesting things. Some people thought that council tax reduction was part of universal credit. Others didn't know that they were actually receiving CTR when they were. And some were not applying for CTR for fear of overpayment recoveries. So some really worrying findings, in a sense, about what the level of awareness of council tax reduction schemes. Now, the impact of universal credit on CTR, can be mitigated. Like many others, the Welsh scheme follows the default regulations on CTR with regard to universal credit cases. So CTR follows universal credit calculations and rules. And this means that universal credit policies are imported directly into council tax reduction. But this doesn't have to be the case. And this was the important point. All the Welsh Government and all local authorities are free to change the rules for working age applicants. And so we did some work with the Welsh Government on measures such as reducing the taper rate, which would benefit universal credit claimants more than legacy benefit claimants, and also costing policy options such as not carrying forward the 2-child limit or the minimum income floor into the council tax reduction schemes. At that point, the numbers are fairly low, so the costs were fairly small, but those sort of things could be easily done. So what we were really pleased about was that not only did the Welsh Government welcome our report, and it's now been published and you can read, I mean, I've only given it a few moments here, but you can have a good look at it. But they've asked us to do a follow-on study to look at the trends, of course, post-COVID. Council tax reduction caseloads have increased quite clearly. And what we are going to do is look at the characteristics of those new claimants, and try and forecast what this is likely to mean for the future of the scheme in Wales, including social and economic impacts. So watch this space, because you know, that research, the first part of it, is due to be published shortly. So in conclusion, what I'd say is that there are kind of 3 pointers here for the future. As Zoe was saying, these studies all have a bearing on what we do in future. And the 3 points I would mention is that I think, first of all, it's important to review council tax reduction schemes in the light of not only universal credit, but of course more recent developments. That we address take-up, and of course the policy and practice tools such as the LIFT dashboard and the calculator can be a real help in trying to identify those people who need that extra support and make sure that they are given it. And the third point really is that what we found here is that we can come up with the evidence to make informed policy decisions. We don't know quite what the Welsh Government will be doing, but they've got all the options in front of them, and they can make decisions about the future as a result of that evidence. So that is something that we will be very happy to do for others too. So thank you very much. I hope that's a very helpful, I hope it's a helpful introduction to what that study gave us. Thank you.
Lovely, thank you very much, Paul. And I know that I have some questions already coming in, so no doubt she'll come back to those towards the end of the webinar. So thank you, Paul. Just before I hand over now to Zoe, I have the first of our polls to serve to you. And what we would like to understand from you, hopefully this is coming up on your screen now. Are you expecting cuts to your budget in the new financial year? Appreciate that. So as with all our polls, please choose the answer that is most top of your list. So is it that yes, I will need to do more with less? Yes, I expect to do less with less. No, I don't expect any cuts, or indeed you just don't know just at the moment in time. Thank you very much. Some interesting comments coming in, answers coming in, and I shall be asking our speakers to respond very shortly. I'll just give you a little bit more time. Of course, end of the financial year, beginning of new financial year is a few months away yet, and who knows what may happen in those few months, the year that we've had. But thank you very much for your thoughts so far. I think most people have voted, so I'm going to close the poll now and share it on screen for you to see. Deven, first, I'll come to you and then to Zoe, if I may. Deven, do you have any comments on those poll results? 40% say they don't know, 35% yes, I will need to do more with less.
Janet, I think it's telling that you don't have a fourth option, which you could have fitted on here, which is I expect my budget to grow. Probably says something about what we're hearing in the marketplace more than perhaps what's existing, because I think there will be budget shifting around. But generally, I think we can look forward to a year of uncertainty with only a one-year settlement in the spending review again, which means that, again, just the ability to plan too far ahead into the future just really isn't there for local authorities and the organisations that rely upon them. It's very difficult. It'll be interesting to see how this is broken down by advice organisations, many of whom I know are struggling, and housing associations who are battling arrears versus the local authorities. That would be interesting to comment on.
Yeah, definitely. Zoe, any thoughts on the poll results?
No, I think Deven's really covered it off. The only comment I'd like to make is that we are seeing worrying signs already that austerity is not perhaps at an end. We're already seeing that the requirements of the public sector in particular are being met by one-off grants rather than any really forward planning, which is causing real difficulty for organisations that are trying to support people. I think there have been some indications that there's central departmental budgets are going to be cut. I'm thinking that although we're hearing that austerity has ended, when we actually look at, I think for those of you who are working in benefits, the new benefit rates from April have just been published today. The uplift has not been included, as we'd expect, because that has to be costed, and it might still change. But I do think we may be moving to a new sort of era of austerity.
Worrying times. Thank you, Zoe. Thank you, Deven. Let me close that poll now. And Zoe, I think we're back over to you for your session. Thank you.
Hi, yeah, thanks, Janet. So I'm going to run through three additional bits of research we did this year. This is going to have to be pretty quick. All these are on our website. So if any of the things I'm talking about sort of interest you, you can look at the whole research and the whole findings by downloading the reports from our website. The first bit of research I want to look at is some work we did, and this is pre-COVID, for the Local Government Association on the local housing allowance and its relationship to homelessness. Now, the driver for the LGA wanting some data analysis and some research on this was obviously on the to do with the LHA freeze. And there'd been a parallel over the years as the local housing allowance has become more and more divorced from rents in areas. There had been a corresponding increase in homelessness. The problem was there was very little evidence to link the two, although common sense said they were linked. What the Local Government Association was looking for was some robust evidence of correlation between the two things. And we're starting from a position where with this research, we found that LHA rates, and this is pre-COVID, before the uplift, were actually sitting at about the 13th percentile. So they had become very, very divorced from local rent levels. We actually found six. We looked at rents available across rents available on the market at the time of the research, and we found 6 local authorities where you couldn't rent a single privately rented property above the at the LHA rate or below the LHA rate. The research actually did manage to find a really robust correlation, and the correlation we found was between the numbers in temporary accommodation. Now, that might be because those numbers are actually provided each year by local authorities to MHCLG. So there's pretty good data on those. And we found that that was related to the percentage of the population who had a gap between the rent they had to pay and the LHA. So we're not looking at the depth of the gap, we're looking at the numbers who have that gap. And I've got some figures here on this slide showing what the final sort of findings were. We found that for every 10% increase in households experiencing that rent gap, we would expect numbers in temporary accommodation to go up by 1%. And for every 1,000 households experiencing a shortfall, we would expect to see 44 end up in temporary accommodation. Thanks, Janet. We then looked at the implications of moving back to the 30th percentile, and that's obviously where we are now, you know, with the uplift because of the COVID measures. And we did averages across the country. Obviously, this doesn't make sense from a council point of view because some councils have nobody in temporary accommodation because their housing stock manages to cope with crisis. Others have thousands, but across the country as a whole, by moving the LHA up to the 30th percentile, we would see 650 fewer people in temporary accommodation. And the average savings to the council because of this are huge. From it reduced between 1.5 and 3 million. So we also then looked, the LGA wanted to look at what impact this could have if all of those savings were put into relief work. So we talked to lots of local authorities. A lot of this was done by actually discussing with local authorities how they budgeted, how they used their money to prevent homelessness. And we found that if all the money that was saved went back into prevention work, it could save on average about 1,000, just under 1,000 people in each local authority going into temporary accommodation. Obviously, this has huge implications now that moving forward, now that we know that the LHA rates are going to be frozen from April next year. And as the divorce between rents and LHAs separate again, all this starts becoming relevant, because we've now built a robust model where we can feed in those differences, the gap between the LHA rates and rents, and actually see the implications on temporary accommodation usage. Thanks, Janet. The next bit of research I'm going to focus on, and obviously this is very relevant, was the impact of the April's uplift to benefits. I'm sure most people on at this webinar know that this was a £20 increase in universal credit personal allowance, or the working tax credit personal allowance, the suspension of the minimum income floor for self-employed claimants, as well as the local housing allowance rise that we've just talked about. These had really quite dramatic impacts on households' income and their ability to cope. We saw the average universal credit claim increased by over £90 a month, nearly 30%, and that really sort of covers the loss of support that came about through freezing benefit rates back in 2016. Thanks, Janet. We've talked about the increase in the LHA rates, but this research actually showed the regional variation of impact of that measure, because it actually, the importance of that to residents actually came down to how much local rents had risen since they were the LHA rates were frozen in 2016. So, for example, in Manchester, rental support increased by 21%, but 2% in Sunderland. But on average across the country, private renters saw an increase of £123 a month, which was, you know, a substantial increase for low-income households. More importantly, we found that an additional 6% now had enough income each month to cover standard bills. And the measure that probably for individual households that had the most impact was the suspension of the minimum income floor. For self-employed households, this had a significant impact in that their support was going up just under £400 a month, 30% increase. And the proportion of self-employed households who can make ends meet, i.e. they could pay the majority of their bills, that went up to 44%. No, sorry, the ones who couldn't pay the bills went down from 44% to 7%. Huge impact. I think that unfortunately a lot of self-employed people had not been eligible for universal credit previously because of the minimum income floor, so they then had to reapply. So that was causing a lot of issues for advice organisations. But I think this was a really welcome measure. And the reason I'm showing the results of this bit of research is that there is still a lot of discussion going on about whether these measures will be retained after April. Final bit of research I'm going to cover before I hand over to my colleague is a bit of research we did for the GLA. So it was all London-based, but the findings were actually relevant beyond London. It was around the interaction of the local housing allowance and the benefit cap. And I think what's important here is that the uplift of the LHA to the 30th percentile was the whole idea behind it was to prevent renters being evicted and to help support their rent during the crisis. But we actually found that the interaction with the benefit cap meant that a lot of private tenants were not seeing that uplift. Households already capped were losing £219 a month on average that they would have received if they hadn't been capped. The worst hit were the private renters with children, and they were losing about £400 on average. Thanks, Janet. I'm just going to finish with this slide. Now, I think this needs a bit of explanation. The orange bars you see here are the actual increase in benefits that people receive because of the government's benefit uplifts in response to COVID. So the combined increases around the LHA, the £20 increase and the minimum income floor change. So the blue lines are what these, on average, households would expect to receive additionally in response to those changes. The orange is what they actually did receive. You'll see there is huge regional variation. Although we've got in London and outside London, some other analysis we did showed that this wasn't just London affected like this. There were 7 pockets across the country particularly badly hit. But if we look at the right-hand side, you can see that only couples without children actually received really any of that uplift. Outside London, couples without children received the full uplift, but they were the only group to receive the full uplift. And as people had more children, the number of children in the household grew, the actual amount of the uplift they saw was reduced. And I know a lot of organisations, frontline organisations, are still talking to the government about the importance of ensuring that the benefit cap is uprated at the same time as other benefit measures. Otherwise, you end up with these very, very severe regional impacts. Thanks, Janet.
Brilliant. Thank you very much. So a very interesting piece. Before we hand over to Duncan, who's going to take us through the next set of research, Deven, did you want to come in and talk to any of the points that Zoe has raised?
Yeah, there was just one point as Zoe was going through the slides. Obviously, we did this, some of the research was carried out right at the outset of the pandemic or just before. And that report we did for the LHA on savings for local authorities as the LHA was restored to the 30th percentile is robust and did exist, but it's based on all things being equal. So in the context of a pandemic, many more people losing their jobs, many more people struggling. While there are savings to local authorities from restoring housing benefit to the 30th percentile, a lot of those won't actually be realised simply because there's too much other stuff going on around caseloads and individual households' levels of financial resilience. So if anyone was wondering, I haven't seen those savings, it's because the analysis was done on the basis of there not being a global pandemic at the same time. Just in case people were wondering.
Yeah, and of course, any savings have been wiped out by the additional caseload of people with rents above the LHA. So you're quite right, Deven.
Great.
Yes, and nobody foresaw the global pandemic, of course. Brilliant, thank you very much. So let me now hand over to my colleague Duncan for the next set of research. Thank you, Duncan.
Thanks, Janet. But yeah, I'm just going to talk about a couple more pieces of research which I think are going to be really relevant still going into next year. First of all, sick pay. So from the onset of the pandemic, there was quite a bit of debate about whether sick pay was sufficient for people to self-isolate. So in June, we looked into it and we found that the average working low-income household, that's those receiving housing benefit, universal credit or council tax support, those households would be losing more than half of their usual fortnightly take-home pay if they were asked to self-isolate and they only had to rely on sick pay. So that would be a loss to them of about £176 in just 2 weeks. Now, perhaps worse, many households wouldn't even be eligible for SSP at all, so would lose 100% of their earnings while isolating. And the combined effect of this meant that we estimated that self-isolation would push 16% of working low-income households into a cash shortfall, meaning they would not be able to meet their costs while isolating. The impact of this potentially was even worse for households not on benefits who may earn more and therefore wouldn't be able to fall back on benefits, but would also have more to lose during the period of their isolation. So next slide. So really this meant, inadequate sick pay meant there was a clear disincentive for households to isolate when they were asked to by NHS Test and Trace. You can see here in the graph just how many households would lose out. A significant portion were going to lose more than £200 in those 2 weeks of isolation. So it was going to be really difficult for many households, particularly low-income ones who didn't have much income anyway. Happily, in September, the government finally responded to the overwhelming evidence that sick pay was a flaw in the Test and Trace plan, with news of the £500 grants delivered by local authorities. Now, this was very welcome, but unfortunately, the evidence suggests uptake has been very low. The criteria around it make it quite difficult to claim. And this week, the Independent surveyed 22 cities and found that of the 1 million people who were asked to self-isolate, just 10,000 people had received the grant. So that's about 1% of self-isolators in those cities. And I'm sure really many of you will have similar experiences of low uptake in your own areas. So really this means our research from June still largely applies, and there remain clear financial disincentives for anyone who is asked to self-isolate to do so. Now the pandemic does hopefully look like it may come to an end next year once we are all vaccinated, but until then it seems clear more can be done to support self-isolators. And even when the pandemic is finished, the issue of inadequate sick pay will still remain, as you can see from the Health Secretary's comments here. All this will lead to greater understanding in government of the need to reform and boost sick pay, both in the short term for the pandemic, but also after that as well. So now I'm just going to touch on one other area of our research this year, which remains topical, and that's free school meals. So it's been a big issue throughout the year, with so much pioneering work done by Marcus Rashford and all of the organisations who've supported him as well. Our research on this found that 1 in 5 families receiving free school meals wouldn't be able to make ends meet over the Christmas holidays without free school meal support. Specifically, we estimated that was around 33,000 families across England who usually in term time would be able to meet their costs, but when it came to the school holidays, due to the extra cost of free school meals, they would be unable to meet their costs. So that absence of free school meals in holiday really does have a significant impact, and it takes these households from just about managing to no longer coping. And of course that impact just gets worse the larger the family is. So the more the children there are, the more the cost of free school meals makes a difference to these households. Next slide, please, Janet. Now, what's more is we pointed out that the UC taper rate actually means that the cost of replacing each free school meal for parents is £8.11, whereas for the government it's just £3 per meal. So it also makes financial sense for this to be a cost which government meets because it's much cheaper for them. Now, happily, support has of course been announced in the form of the COVID winter grant to allow councils to provide extra funding to free school meals households until March, and the holiday activities and food programme has also been extended throughout next year. So we're now working with various councils to help them target that winter grant funding and make sure it reaches those who need it most. But given the difficulty the absence of free school meals during holidays causes, and what our research showed, we do think a long-term funding package to reduce holiday poverty beyond March does still need to be put in place. And now finally on this last slide, just to bring these two issues together, on both sick pay and free school meals, we welcome the government responding, but what is needed now is action to create long-term solutions as well as emergency ones, because these aren't problems which are just going to disappear along with COVID-19. Sustainable policies which work with local councils to address child poverty and hardship need to be put in place for the post-pandemic world as well. And these long-term solutions should also consider the impact that we showed free school meals had on larger families. So any solutions have to consider how these bigger families are already targeted by policies such as the benefit cap and 2-child limit. And that's why we've also recommended not only long-term funding to avoid holiday poverty, but also increasing or removing the benefits cap and scrapping the 2-child limit to ensure those who most need support can receive it, not just during this pandemic, but for the rest of this government's term and beyond. So yeah, on that note, I'm just going to hand over to Deven for a quick poll on your priorities in the next year.
Great, thank you.
Excellent, thank you very much, Duncan. Let me, as Duncan said, let me serve the other poll just before handing it over to Deven. And what we're looking for here is what are your priorities for 2021? Hopefully you should see that on your screen there. Thank you. Excellent. Okay, so yes, so what we want to know from you, what are your priorities for 2021? So please choose one. I do appreciate it could have a combination, but is it tackling debt and arrears? Is it boosting employment support? Is it preventing hardship? Is it maximising incomes, or is it saving money in your department on behalf of your organisation? Like I say, I'm sure any kind of combination of any of those factors, but we're looking for the main driver at the moment. I shall just give you a few more moments to vote. Thank you very much. Just to say that we are always very, very interested in how our audience vote on our polls. And we're always just very interested in feedback from all of our client base and all of everybody on the webinar as well. It tells us a lot, so we're always very interested. Brilliant, thank you very much. So I shall close that poll now and then share that on the screen. Deven, for you to comment on. Hopefully,
well, great,
Deven,
thank you.
That.
Yes, thank you, Janet. And very good of everyone just to contribute. We can see debt in arrears high up, preventing hardship and maximising incomes being the main two. And somewhat surprisingly, seeing employment support lower. But I think that's just because of the role that sort of advice and benefit organisations currently play in that. We think that they've got a bigger role to play, because before you look for work, before you're ready to look for work, stabilising your income can be quite an important thing. And there is a lot of money going into employment support from the government. But I think you need to get housing and financial circumstances right to make the most of that investment. I think there's a lot more to say here, and hopefully I'll try and cover it in the following slides. It might be good for, at this point, for Zoe and Paul to come in if they've got any further comments.
I haven't really, Deven. I think you will be covering it. I think the maximising income is obviously the most pressing need to prevent crisis, and I think particularly given the amount of unclaimed benefits, and I think for people moving first time onto universal credit or any means tested benefits, navigating the system is particularly hard. Understanding that universal credit is only part of a package, only a tiny part of the support people could get, but also being signposted towards all those other areas of support, I think is really important as people start relying on benefits.
Great, thanks, Zoe. Paul, was there anything you wanted to add at this point? Perhaps not. Okay, so yeah, I think if we move back, I'll try and cover these points in the subsequent slides, but that's exactly what we're hearing from the frontline organisations that we work with. I actually expected them all to be pretty much equal. So I think it's interesting where we see employment support currently, and I think that's more to do, again, with the roles of the organisations. Zoe, you've,
sorry, Deven,
sorry.
I see that Paul is unmuted now. Paul, sorry, I think I'd muted you by mistake.
You did, yes. So I was speaking, but nobody could hear me. So,
sorry, Paul.
But all I wanted to say was that I'm pleased in a way that maximising incomes figures as the highest, because I know these things are all related, but that is a key theme, I think, that's been coming out of the research we've done, and it is still the case that a lot more can be done in this field. So hopefully that is what will happen over the coming years, that there'll be a big push to make sure people who are actually entitled to things now and not getting them, do get them in future.
Great, and you'll be aware as well, of course, that these are the areas that we're also investing in significantly. So investing in our software to help people to maximise their incomes, carrying out analytics on the impact of debt and what can be done if you actually tackle debt early and holistically, with income maximisation as a part of that conversation, actually, because a lot of people in debt aren't getting all of the support that they're eligible for. And obviously a lot of our work on prevention, which I think you can see from the policy work that Paul, Zoe and Duncan were just talking about there. Janet, you might need to, if you close the poll, I think we'll go back to the presentation now.
Yep.
Thank you. And before we move forward, I think just one point I wanted to make, which was just to second what Zoe said right at the outset, which is a huge thanks to all of the organisations who are on this webinar, and also those that aren't, that have spent a huge amount of their time, energy and personal effort on supporting people through this pandemic. It's very easy to forget what a momentous year 2020 has been, with things that we couldn't have imagined in January really fundamentally just changing everything for the course of the year. We're all working from home, apart from myself and Duncan today, it seems. It's changed our working patterns, it's changed our a lot of people's lives, and you saw from the stats that Zoe spoke about early on that it's actually affected a lot of people's financial situation very quickly, and these people have had to engage with the benefit system and social security often for the first time. And that's where, again, I think obviously through our tools we do the best we can to help and support them. And I was really proud of all of the work our team did in answering 2,500 individual queries from people and turning them into an FAQ right at the outset of COVID-19. But I think all of the credit really goes to the frontline organisations who are dealing with that sort of day in, day out. So I just wanted to start with that first of all, before moving on to the outlook for 2021. So do we have sunlit uplands ahead I asked that slightly tongue-in-cheek. There is some really good news. We've got a vaccine on the way. So the idea and possibility of life getting back to normal at some point, possibly around March, April time, is a real possibility. And actually, I've noticed just in the last few months that that's people's expectations now, is that things will get back much more to normal. I think some things have changed forever. And hopefully one of those things is people's recognition of the importance of a strong social security system as part of that. But we'll see whether or not that's the case in the long term. We've got another major milestone for anyone who's been following the news over the last week or so is a Brexit, still a deal or no deal scenario, just, I mean, days before we're due to leave the EU. We know actually with the deal, even with the deal that's on the table, it's going to have, or it's projected by the OBR, at least, to have a negative impact on economic growth, at least in the short term, and a no deal would be considerably worse. So I do hope we come back with a deal. We've actually carried out analysis for a number of councils on the impact of recovery and the impact of Brexit, which are areas that we can help individual organisations with. Then there's the question of the deficit. Are we going to hit austerity Mark 2? Or are we going to see the government spending to promote growth? You've kind of seen the Chancellor throw traditional budget rules out the window as the pandemic hit. And there's still a lot of new spending in the spending review, a lot of it COVID-19 related. Actually, when you look behind that, you can see actually departmental budgets themselves being cut, continue to be cut when you remove that COVID-19 spending out of that. We saw at the outset kind of a third of the organisations responding to our poll on this webinar saying they expected budgets to shrink, and about 40% I think saying they didn't know. And I think that highlights that actually kind of there's a lot of uncertainty out there. And a lot of concern too. I'm mildly optimistic, again, possibly wrongly so, but the policy, any sensible policymaker in the Treasury will be saying, actually, if you want to cut the deficit, you need to get the economy back to an even keel quickly. We know the impact of this pandemic has been hugely unequal, actually. So there's a lot of people who have suffered greatly, as Zoe was outlining, and that's really what this webinar is about. But actually, a lot of people have done okay. If you look at savings rates overall, about half the population have seen their savings rates increase. They've been able to pay off credit card bills. So that kind of inequality, tackling that inequality, should be a priority for any government. And the social security system is one way of doing that. You can see some investment from government. So you can see the £2.9 billion restart scheme, an additional £1 billion plus going into the expansion of Job Centre Plus. To help people back into work. That suggests they're seeing employment over social security perhaps as being the route to that. As I've argued already, I think you need a strong social security system to, in some cases, enable people and position people to be able to look for work, particularly those that are furthest away or at risk of having just now lost their jobs, moving further away. It's strange to me that the £20 uplift to universal credit remains uncertain. That would have been a very easy win for the Chancellor in the spending review. So it's strange to, again, continue to put people's budgets just 3 months from now, millions of people's budgets 3 months from now into a great deal of uncertainty. I've already spoken about the fact that when you take COVID-19 spending out of the equation, you're still seeing cuts to departmental budgets. So huge amounts of uncertainty there. Janet, if you move on. So I'm not sure about the Sunderland Uplands, candidly. I think one of the things that organisations can do is to start thinking about and start to plan for the future and tackle those kinds of areas that we had highlighted on our poll. So helping people in arrears, helping people to maximise their income, helping people into work where they can as the recovery comes back. And one of the things every local organisation needs to keep track on is how is that recovery panning out in their local area? Who is continuing to struggle? Where are the green shoots of recovery having the biggest impact? So as I mentioned, we've done analysis this year on the recovery from COVID-19. So we're looking at that. Again, as assumptions change, but we've done pieces of work there for Ada and Worthing and Luton Council just recently over the past number of months. The impact of Brexit, we did quite a lot of at the start of the year, again, looking at deal and no deal scenarios. And I think this kind of analysis can help local organisations really to plan for the future. In many respects, that's the work that we've gone on to do for the Welsh Government. We've just completed an interim report that we're about to share with them on the impacts of COVID-19 on council tax support costs and caseloads, and being able to plan for that, I think, is really important for local authorities and other organisations in a very uncertain environment. I think you might want to join council tax is another sort of big area of change because of the impact on caseload. So I think you reached kind of last year, a number of councils moving toward much more discount type schemes, simple schemes essentially to help them to administer council tax support. What they weren't imagining was huge changes in caseload shifts. So we've been able to adapt our council tax support analysis to take into account those caseload changes. I think you saw Zoe go through some of our work looking at modelling and forecasting the impacts of today, but also the outlook for employment in the future onto those caseload impacts, so we can start to give, again, a baseline for you to plan in a very uncertain world. And I think the final area of prevention was another area on that poll, and I think we've been working on prevention for a long time. I think this year we've seen a lot of organisations have to move away from prevention to just dealing reactively with the number of people who have found themselves in great difficulty. I think prevention comes back simply because if you don't help those individuals, they just get into a worse situation. So there is this prevention piece in just helping people, the right people with the right support, reactively and early. And just as an example of that, Janet, I thought it'd be helpful just to highlight for those that aren't able to stay around for the demonstration later. If you move forward, Janet. Our benefit take-up screen. So this is some analysis that we've done and recently just made considerably more accurate thanks to a lot of the work Zoe and the team have put in, particularly around those high-level benefits that have particular complexities around them. So severe disability premium in particular. We've got the gateway to severe disability premium closing in January. So the councils that we're working with that are using our lift analytics can actually use that to pull off a report of people who we are pretty certain now are missing out on severe disability premium. If they make that claim now before the gateway closes, one, they're protecting households from the move to universal credit by ensuring they get the transitional protection when they move across, and two, they are also making it easier to get backdated payment because you'll be working with the record as is instead of having to hunt back for like in your old records, I suppose, to find out what's going on with severe disability. So that's one area where I think there's a real immediate need for organisations to use analysis to help maximise people's incomes. I think there are a number of other areas though, and it's not just about the social security system as well. So we're doing a lot of work with water companies and the energy sector, and we've pulled a lot of their social tariffs into our analytics engine. So you can see people who might be missing out on, for example, free childcare, Healthy Start, Water Shore, or the specific tariffs that are run by individual water companies, and making sure that if they are in debt or in arrears, you're not just helping them with the debt they're currently facing, you're helping them holistically to try and avoid debt in the future as well, making the impact you're having much more sustainable. And we think, and in actual fact, we know from work we did this year with the Cabinet Office, that that's a much more cost-effective way of tackling debt, delivering a return of around 25 to 35 pounds for every pound invested in that sort of campaign. And then I think there's an opportunity here, hopefully, to make a bit of a longer term change. So as I think Zoe said at the start, I think universal credit's shown that it can work to deliver benefits to people at scale. It's shown itself to be valuable in this pandemic in a way that probably the legacy system simply wouldn't have been able to cope. However, there is still quite a lot of room to improve universal credit. So introducing greater flexibility around backdating, around consent, and taking advantage of the support that welfare advice organisations have to offer in helping people navigate the system, introducing payment flexibility, and a project that we've just secured and we can talk about today because it's only just been announced, helping people to understand their next month's universal credit. So we just secured some funding from Nesta to build an app that allows people to see their project their income into the future. We're really excited about that, and we'd love for people who are interested in that and want to perhaps be involved in the co-design, or ideally can put the individuals they work with, so claimants themselves, because this is very much an individual-centered project. If we can help work with individuals to make sure we're designing the app in a way that they most need, I think that would be really useful. We're hoping to set something up in January around that. So if you're interested and feel like you can contribute to that, please do drop Janet an email, hello@policyandpractice.co.uk, and we will start to collate that and be back in touch. Janet, if you skip back to that earlier slide. Yeah, and I think another point for those that are on the webinar, again, friends of Policy and Practice by virtue of being here, or at least I hope we're friends, is to make the most of universal credit data. That's another big theme of what we're doing right now. So we're about to submit a response to the National Data Strategy, and we're hosting a roundtable tomorrow, actually, again. So for the local authorities involved that want to take part, it's essentially making the case for DWP to share universal credit data and allow for that data to be used for a wider range of purposes than they currently permit. So really making the case for that, not ourselves, but really just consolidating a group of local authorities and acting as kind of experts on the data side of things and the government side of things to help local authorities make their voice heard a little bit more. So the more organisations we can get involved in that, I think the better. And hopefully calling as well for a very clear role for local authorities in providing that holistic support. We saw in the responses to the poll, they don't really see themselves in the employment support space. Yet there's £2.9 billion of funding going toward employment support over the next few years as part of Restart. And again, the settlement for local authorities around that has been, other than the grants they're distributing, the actual support they have to kind of help individuals sustain any improvements they're able to help them maintain is still lacking. And then finally, we'll all find it difficult to make progress if we don't reverse some of those austerity measures. And as I said, there's a strong policy case for that because it'll help both the economy and our society to recover from the impacts of the pandemic much faster and in a much more inclusive way. So hopefully we can all speak of that to one voice, to Rishi and the government. Thanks, Janet. And hopefully there are some questions that have come through too.
Yes, thank you, Deven. There have been a number of questions, but there's plenty of room for more. So do please get your questions. The more complicated, the better. We have the experts on the panel, so why not? Sorry, team. So just before we move over to the questions, so yeah, as Deven talked about there, so here are some practical tools that we think can help. So we've mentioned there about the benefit and budgeting calculator, and Deven talked there on the benefit screen to do, and that is from the low-income family tracker dashboard. And we talked there about the coming soon, just announced today that we have been shortlisted for, we've become a semi-finalist for a Nesta competition to develop an app, which we're really excited about and really are hoping to make massive impact. What I would urge you is to stay updated, and who knows what next year will bring in terms of policy changes, but we are very keen to analyse policy as and when it changes and get those, get our take and simplify those changes out to people. We have the coronavirus page on our website that will still be updated, constantly updated with changes. We also have our monthly newsletter, which brings all of our policy work together, and indeed our blog posts as well. So do sign up to that if you're not already. The first of our next webinars will be on the 27th of January, and that is going to be on flexible collection policies. So do please, and there'll be a link for you to sign up in the survey at the end of the webinar, and there will be more monthly webinars to come as and when we get them confirmed. Brilliant, thank you. So without further ado, let me move over to the questions and answers section. So I'm going to start now with okay, I have so many questions. Where do I start? I have a question here from somebody who has said, I've been wondering whether you've seen any impact of the physical health consequences of COVID on benefits. For example, long COVID increasing the rates of disability benefit applications. Is that something that has come across our radar yet? Don't know who wants to take that one, perhaps, Zoe?
I can say something about this, Janet. In actual fact, we've seen the numbers with disability in the caseload drop. Very, very peculiar findings. By just a small amount, they're not increasing. So I checked into the DWP stats on this, and there actually have been lower numbers than expected of people either claiming PIP or the mandatory reconsideration. So the DWP are explaining the reduced numbers on PIP and DLA because of the difficulties with assessments and the delays and the backlogs while during lockdown. But we're actually seeing that DWP comment on the numbers going down, which is really surprising over if you consider it's been going up generally over the last few years. And we're actually seeing that come through into the caseload, which took me by surprise, but there you go. It's actually what will be interesting in this is as we carry on our analysis into next April, and we're doing a large piece for the Welsh government. We've looked now, but again in April. It'll be interesting to see if that carries on now that the government, now the DWP is saying that they're getting through that backlog of PIP assessments, and of course long COVID coming into it, and people start moving off sick pay and perhaps actually going on to more longer term disability related benefits. It is interesting. I think it's certainly something we'd like to look at and monitor into the future.
Lovely.
Yeah, I'd just
Sarah.
like to add that it's a great question. So thank you to the person that asked it. I think our approach to analytics means that it's actually a question that we might be in a position to answer alongside the DWP. So as Zoe said, we'll look into it alongside the Welsh Government, but it'd be great, again, just to get more authorities involved in using their data, pooling their data. So we're not just looking at it in one part of the country. We can actually make the analysis much more representative of the country as a whole, because I think that's what really moves arguments in the civil service.
Excellent, thank you, Deven. I have a question, and I think possibly Paul, this might this question came in when you were talking through the findings from the Welsh work, the work that we did for the Welsh Government. And this person says, people who previously applied for housing benefit automatically also applied for council tax support. Many who apply for UC also think that council tax reduction will also automatically apply. They don't appear to have been informed that if you apply for UC, you also need to apply separately for CTR. So I think that person who's basically pretty much backing up exactly what you said were our findings. Is there anything, Paul, that you would like to expand on with that? Perhaps some of the stuff from the surveys that we did with the Welsh work?
Yes, I mean, I think that's a very good point. What we found was that there is evidence that this separation of processes, you have to claim for universal credit and apply separately for council tax reduction, is certainly not fully understood, and I think is affecting the take-up rates of CTR. I think that is undoubtedly the case. And so, you know, there needs to be more put into the awareness there. What does happen, of course, is that when people claim universal credit, then they should be asked about whether they're actually intending or have claimed for council tax reduction, and that leads automatically to a exchange of data between DWP and local authorities. And at that point, quite a lot of local authorities now are treating that contact from DWP as an automatic application for CTR. So, you know, that process in itself can be helpful. But I think, you know, the fact that the two things were all claimed together, housing benefit, council tax benefit, obviously now that separation has led to some reduction in applications, definitely.
Janet, can I just add to what Paul said there? Is that if you look at the data, the local authorities administrative data on this, and I think this underlined, go back to Deven's point about the need for wider data analysis on these sort of issues and the more sharing of data from DWP. We're seeing a lot of people, and the migration of people from legacy benefits to universal credit has really speeded up. A lot of people, changes in circumstances who are on legacy benefits triggering a move to UC. A lot of these are getting lost. So although we're seeing large numbers of this UC CTRS caseload going up, we're not actually seeing all those who are coming off legacy benefits, or in the numbers we would expect of people who lost work, rather than just because they've all found jobs. They're not going necessarily onto the universal credit CTRS caseload. There is a drop off there. As Paul said, the move by some local authorities to take the first notification, the household detail notification, the UC start notification as a claim, makes a big difference. I mean, there's probably some work we can do at policy and practice, and we have actually written to all Welsh authorities, asking whether they do that, because some do, some don't. And I think it's going to be really interesting to see if that has a difference on taking that caseload through. But one of the other things we heard from one local authority was that they used to have people sitting in the job centres. So they used to have people, as people had their first interview, actually just checking that they'd claimed CTR. Obviously, with lockdown, social distancing, a lot of that additional input by local authorities to make sure people claim CTR has had to be put on hold at the moment. But we're definitely seeing this gap in the data, definitely. So I think it's a really good question.
Just sticking with CTR, and just a very quick answer to this person that's asked this question, who hadn't realised that councils make their own rules on CTR. Does this mean that your calculator knows the rules for every council tax support scheme?
Oh yes. Oh, you would not believe how much work this is. I love the question. So the whole team, from about February, March onwards, start reading through every single council tax support scheme design in England. And we have we've built in all the provisions for all those schemes into the calculator. Now there are some very weird and wonderful provisions that we can't we can't necessarily include. But in that case, you get a warning that this is based on 90% of the provisions for that council. So yes, we do. It's a lot of work. I'm very proud that we have that in our calculator, because the differences between schemes is so great that you can have one scheme where it's based on 100% of liability. Next door borough, people have to pay 40% of their liability as minimum. The difference is so enormous to household incomes that I think it's really necessary that that is built into the calculator.
Brilliant, thank you, Zoe. Deven, a question for you from somebody who says, Deven, you mentioned deal or no deal Brexit. How would you see each resolution affecting those on benefits and authorities in general?
Hello. Yes, deal or no deal. I mean, that is the crystal ball, but we do know the OBR have accurately forecasted from their perspective. So this is the government's own forecaster have said what they expect the short-term consequences of a no-deal Brexit to be. I think that's a loss of around 6% to kind of overall GDP and incomes. And some of the work that we've done is map that onto unemployment and look at those impacts on possible caseloads for benefits. The other modelling we did was look at the other information we've got is an understanding of the impact that's likely to have on food and other prices. And as many of you will know, a lot of our work on poverty has been about looking not just at the income side, but also looking at the cost side. So when you're seeing the costs, the potential cost rises from Brexit, you're seeing a lot more households who were keeping their heads above water, where costs are rising just above that level, and they start to dip below. And obviously for those that were already struggling, they start to struggle even more. So those are the kinds of levels of impact of a no-deal Brexit. A deal, any deal, is still better than that, but they pretty much at this point, they all see a rise in food prices and a drop in employment levels. That's kind of forecast across the board. So kind of however you voted and whatever the long-term outcomes of Brexit, I think the short-term consequences, particularly for low-income households, are going to be difficult, and they're going to be felt across the board. And therefore, what we all do as organisations to support those households is going to be critical.
Lovely, thank you, Deven. I'm very conscious of time here now, but if I can just squeeze this last question in, and this person is asking, and apologies to people who ask questions I haven't got to, we will get those answers to you after the webinar offline. But this particular person says, have you any particularly striking data this year on failure to take up benefits? I'm not sure which one of the panel, you're all equally able to answer that one, so I don't know who wants to go first.
We're all looking at each other.
Nobody.
I might jump in and nominate.
It's finding people not there. We have worked with a lot of local authorities where we've given them lists of people within the low income population, low income residents, that don't appear from the data they have to be claiming benefits. And there's a lot of case studies on our website about that. I won't go into the different benefits, but there's certainly been huge success by local authorities taking a proactive approach to getting people to take up benefits. Some of the most exciting casework around that has actually come from housing associations, because they who are using our calculator and checking all their residents are getting all the benefits that they're entitled to. And I think we have a case study, don't we, Janet, from one housing association with quite tremendous increases in average household income because of the proactive work they do.
Yes,
but I would say go to
definitely,
our website. There's quite a few case studies there, but it's different between different benefits and different organisations that who've carried out these exercises.
It's very difficult to come up with research on sort of take up as a whole, because obviously it does rely on surveys and samples and asking people about their income, and that's why take up estimates are always, there's a lag of usually a few years before you get any information, because it's based on asking people questions and sorting out the answers. So it's difficult to do it across the piece, but clearly what we can do, as Zoe's just said, is work with local authorities and others to actually identify those who appear not to be getting what they should be getting.
Yeah, and if I can just come in, I suppose the point I would add is the number of new claimants that you've got coming into the system now, as Zoe highlighted, so more than doubling the number of people on universal credit. Hopefully you'll see some of those people leave the system again who might have just had a short-term shock, and the economy recovers quickly. But actually, I think you'll see a lot of those people continue to struggle. And what I think, I haven't got the data to back this up, but just because I haven't looked at it ahead of this webinar, but I do know that by looking at our local authorities data, that we can see for those people that are newly claiming, they tend to be missing out on more than those that aren't. And I think what we're starting to see now is councils and frontline organisations with a little bit more time to get their head up from just being purely reactive to getting food parcels out and immediate financial support, to actually take up this proactive, being slightly more proactive and holistic with the people that are coming to see them about other issues. And I think it's important to say that often, if you want to tackle the other issues, whether that be housing or employment or anything else, you do need to sort out often income first. So trying to just sort out the kind of the single issue. If you want them to be able to stay in their home, it's helpful to be able to look at making sure, again, I think that's where some of our housing associations like Clanmill, Grip Cwnefin, Guinness, Curo and others have seen real benefits of actually just helping people to stabilise and stay in their home.
Brilliant, thank you, Deven. And I just want to sneak this last question in because this person says, I'm in Scotland, what's the story here? I'm not quite sure which part of the session that was in relation to, but Zoe, do you just very quickly want to talk a little bit? We didn't talk about it in the policy recap, but we have done some important policy work based for Scotland this year, haven't we?
We have. We've actually given evidence to a select committee in Scotland on the welfare provision in Scotland, and we've just put in some written evidence on welfare provision and how this differs between England and Scotland. So we have actually done some work there. I think Paul's presentation on the interaction of the council tax deduction scheme and universal credit is very relevant to Scotland, because Scotland, of course, do that, but it's based on 100% liability. I know that the Scottish government is looking at changing their CTR scheme so that it doesn't automatically incorporate UC elements. And obviously that happens, we're going to be following that very carefully. We'll probably do some analysis on it. But we respond to the Scottish Select Committee's call for evidence and do data analysis on Scottish data in exactly the same way. So if you go to our website, you'll be able to find Scottish specific sort of analysis, and actually where we've brought out the differences between the two welfare systems, and how the child support payments, for example, and I think we've put in a call for those to be brought forward. We've done some analysis on the impacts that those will make to financial resilience. Our calculate and frontline tools cover Scotland as well as England.
And Northern Ireland as well.
Yeah, and Northern Ireland and Wales. Yeah.
Brilliant. Thank you very much. I'm going to end the questions there. Like I say, there are some other questions that I haven't got to, so big apologies if yours questions was one of those. We will get back to you after the webinar. Thank you very much to our panel as well. What I would like to do now, I would like to say thank you to Zoe, Paul, Duncan and Deven